Hello, massage family and extended massage family. I'm going to be talking about a part of the body today that is highly requested from a lot of you. A lot of us are suffering in this area, and so I just want to teach you a few things that you can do to give yourself some relief until you can either get back in with your chiropractor or your massage therapist, whatever body worker that you choose. But again, these are just a few movements that I want to show you that hopefully can relieve some of the pain, discomfort, or tightness that you're having. So something we have to realize about our bodies is that when we're having pain or tightness somewhere, it's not always the root of the problem. So we have to kind of do some investigative work and figure out the root of what's causing us all of our troubles. So a lot of times, low back, even glute, hip pain can come from this sweet little muscle in our bodies. I'm not going to tell you what it is yet, but this muscle is one of only two muscles that actually connects our upper torso with our lower half. So it's doing a lot for us, and it gets abused and overused, and it's unknown to a lot of people. But drum roll, that muscle is your iliopsoas, and we just usually refer to it as your psoas. So I want to show you just this simple little diagram here so you can understand what we're going to be doing today. So here is the psoas major, and you can see how kind of long it is. The important thing to know is that it connects on your lower part of your spine, on your lumbar, in the back, and then it cross sections and comes through your midsection, and it attaches on the front part of your hip. So just if you could look at your body at kind of at the side and cutting through, it's literally going from the back to the front. So when it gets tight, constricted, and stays that way, you can kind of start to understand why it starts to pull on low back. And then just depending on some other variables, it could be many other things that I can't go into right now. But that can be why you're having all this pain. And so I want to show you how you can begin to release that psoas. And hopefully you can do this every day and see if you start to get some results. Okay, so like I've said in some other videos, we can tend to get stuck in these seated positions, which is a flexion position. And there are other postures that you can be in, like a cyclist or even runners. There's a little bit of flexion there. Or sitting on the couch and watching Netflix all day. That's a flexion position. But sitting at the computer mainly for a lot of us gets you stuck in that flexion. So what we want to do before we get into some of these releasing things that I'm going to teach you, I want you to warm up the hips. Now, if you don't have an exercise ball, go get one. Order one off Amazon. They don't cost much. But what we're going to do is I want you to sit up really straight and keep your upper torso as still as you can. And what you're going to do is you're going to do really big circles. And I like to do about 10 to the right. And you're really exaggerating your circle, but you're keeping your upper body nice and still. Then you're going to do 10 the other way. Great. So 10 to the right, 10 to the left. Now we're going to do 10, actually we're going to do 20, side to side, okay? And do those. And then we're gonna do 10 forward and then 10 backwards. So forward, and again, trying to keep our body, upper torso, as stationary as possible so you can get all that movement in the hips. And then the last one is like a diagonal. So we'll do 10 on that right side, and then we'll do 10 on the left side. Great job. Another movement that you can do on the ball that's really, really good for you, you can also do this on all fours. And in yoga, it's traditionally called the cat-cow pose. So on the ball, you can just simply round your shoulders like this, and then like this. So what you're doing is you're getting movement back into that spine. And it's just nice to do it on the ball because you're already there doing all the hip rotations anyway. But that's another really, really great way to get that back kind of warmed up before you go in and try to release that psoas. So, you know, do 10 to 20 of those. Those feel really, really good. And if the ball doesn't feel comfortable to you, like I said, you can get down on all fours and do it that way. Okay, so now we're going to use another tool. So what we want to concentrate on now is that lower lumbar area and just trying to warm that tissue up and just try to get it to become a little bit more pliable and give a little bit. So if you do not have a foam roller, I highly suggest you get one of these too. Or you can get a PVC pipe and wrap it with a yoga mat. You could do that, but they're pretty cost effective now. You can get them just about anywhere. So you can just get back, use your arms to kind of support you. And I'm gonna focus on my left side, my left lumbar. So I'm kind of leaning a little bit to my left, and I can just go as slow as I need to kind of get into that lower lumbar section of my spine. And it feels really, really nice. You know, you could do it for like a minute or so until you feel like it's just kind of letting up a little bit. And then of course lean to the other side and do the right side. And that's just a great tool to get that lumbar to let go. Good job. Okay, one more tool that you can use in the back area before we get to the psoas and move into the front are 2 balls in a sock. And you know, you use tennis balls or little harder balls like bouncy balls, whatever feels good to you, whatever you can handle. But if you have used the foam roller and the lumbar is just kind of still stiff and not wanting to give, you can use these balls and get right into what we call the SI joint. And so if you take your hand in the back and just kind of go right in the center of kind of your glutes where your spine kind of meets your hip area. Right there, it's your hinge, that's your SI joint. So you're gonna take these 2 balls, one on either side, however wide apart you need to get them, and you can lay back down on the yoga mat, or you can lean up against a wall and just kind of knead that area. It's hard for me to show you, so I'm just kind of trying to explain it to you. But you can lay on these and try to get that joint and all those attachments in there to kind of, again, loosen, let go, not be so constricted and holding in tight because they're stuck from sitting all day. But this is also great to use all up and down your spine. So it's a cheap way to get you through until you can get to one of your body workers. Okay, so for the final movement, let me show you this one more time. The area that we're going to try to release right now is this anterior or front section of this psoas, okay? So once again, we're going to use a tool. You want to get a ball about this size. It's kind of like a softball size, maybe a little bigger, and it's a little squishy, but it's not too hard and it's not too soft. And so what we're going to be concentrating on is, like in that diagram, if you can find your rib and go just below the rib and travel down to where your hip is, if you can find your hip bone. So this is kind of the section you want to use this ball in. Great. So I've got my ball in that little area that I told you about. And what I'm going to do is I'm just going to slowly teeter-totter my way. See right there, I can feel tightness. So I'm just going to stay right there for a minute and teeter-totter back and forth. I can even just let it sink in there. It's doing all the work for me. And then I'm just going to keep working all the way to that hip bone. And then I can go back up and back down, whatever feels good. Now just remember, if there is pain, stop. You could also, you're in control of your leverage and how much pressure you're putting into that ball. But it is going to be a little uncomfortable, especially if it's really tight. But hopefully, if you've done all the other movements ahead of time, hopefully things are starting to let go a little bit. So good luck. Let me know if you have any questions, and hopefully this helps. Have a wonderful day. So for those of you who are interested in the bonus material, which is the emotions that are held in these spaces. So I picked obviously the hips and low back. As I've told you in other videos, emotions can get trapped or stored in specific places of our body. So through research, it has been found that these things could be being stored or trapped in let's do your hips first. So the hips is can be fear of making decisions, that you have nothing to look forward to. Could also be lack of emotional and physical self-support. If you get into the hip joint, it could be not wanting to accept present experiences or non-acceptance of physical experiences. So that hits home for a lot of us. And then to go into the low back, into the lumbar, you can have feelings of feeling unsupported financially, fear where any kind of money situation is concerned, and then also wanting to back out of something, no pun intended, or that you're possibly in a relationship that hurts. So if any of those resonate with you, that's something that you can just kind of sit within yourself. Maybe as you're doing some of those hip movements on the ball, maybe it's that fear of being unsupported financially is maybe yours. Maybe that resonated with you. So as you're moving through some of those movements, you can just speak positive words over yourself that, maybe you can just focus on today. Like I have everything that I need today, and I have all the supplies that I need in life today. And so I'm not going to fear. And whatever it is, just find a mantra, find a few words, and as you're breathing and working through the movements, you can be intentional about moving that emotion through you as well so that it doesn't stay stuck. Okay, that's about it for today. Hope you have a blessed day. I hope this relieves some of the pain and or tightness in the hips and the low back. Thanks a lot.